Welcome to Healing at the Speed of Light. Every week we discuss how laser therapy is changing healthcare and how you can benefit. Now here is your host and founder of Laser Therapy Institute, Dr. Jason Roundtree.
Hello and welcome back to Healing at the Speed of Light, your weekly laser therapy podcast. My name is Dr. Jason Roundtree, and today I'm going to be walking you through plantar fasciitis. Plantar fasciitis is one of those things that a lot of people have heard about. Some number of people have been diagnosed with. When you really have the disorder, it can be very brief, it can resolve fairly quickly, or it can be ongoing for a long time. Those who do have it chronically, or who've got it that's been happening for more than several months, it can be really kind of discouraging and can really limit your abilities and things that you feel like getting out and doing because of the pain level. So let's jump into what plantar fasciitis is. So most people have heard of something like plantar fasciitis, understand it is pain in the foot. Now, unfortunately, I have seen dozens of patients that have misdiagnosed themselves or have been misdiagnosed by a medical provider as having plantar fasciitis, and it ends up being a totally different situation with foot pain. Not every painful foot is a condition of plantar fasciitis. So the first thing you need to do is kind of understand a little bit about this disorder so that you can know if it kind of sounds like what you've got going on. And then you need to get a good workup, a good diagnostic workup, so that you can know what you're dealing with. Because if you've got the wrong diagnosis, you're going to be going down the wrong treatment pathway, which means you're not going to get good success no matter what you do. So plantar fasciitis is technically, it's a progressive degenerative condition, so not that dissimilar from arthritis, really, only we're talking about the soft tissues, not the joints. So it's a progressive degenerative condition, and it affects this very thick band of tissue that covers the bones on the bottom of the foot. That is called the plantar fascia. Make sense? So plantar fasciitis is inflammation of that plantar fascia. Now that plantar fascia is very important. It kind of holds the bottom of the foot together. It provides extra support to the bones of the feet, makes you more resistant to sprain, strain, injuries. But it's a very thick band of tissue that doesn't really get that good a circulation. So once it gets inflamed, once something starts to bother it, it's difficult for the body to reduce that inflammation in there and kind of clean that tissue out so that it doesn't continue to be inflamed and to be painful. Now, this is not all that common as far as medical conditions go. It's about 1% of U.S. adults who will report a diagnosis of plantar fasciitis every year. But again, I've seen a lot of people that come in with a diagnosis of plantar fasciitis, and it turns out to be something totally different. It can be a stress fracture. It could be a heel spur, a bone spur on the calcaneus, the heel bone. I've even seen this be mistaken for tarsal tunnel. Tarsal tunnel is a nerve condition not too dissimilar from carpal tunnel. Carpal tunnel happens up in the wrist. You get some entrapment of the median nerve in the wrist, and you get numbness, tingling, burning, pain out in the fingers. Well, it's a similar situation down the foot. On the inside of the ankle, the medial side of the ankle, you've got a nerve that runs down kind of right behind that ankle bone, and that can get entrapped, it can get inflamed, and then you can get pain, you can get tingling, numbness out into the foot, and unfortunately, many, many times, this is diagnosed as plantar fasciitis, even by medical professionals, because it just isn't, tarsal tunnel is not one of those that's really commonly known. So again, going back to getting an accurate diagnosis, if you have foot pain, it does not necessarily mean it's plantar fasciitis. A little bit of testing and some x-rays really do help. Now, what you're going to see on testing is pretty much nothing. You're going to have x-rays that look totally normal. Some of the orthopedic testing that can be done will be completely negative. And that's all good, because you don't want to have to deal with a stress fracture necessarily. You really don't want to deal with nerve entrapment and tarsal tunnel. So you want to know that on an x-ray, everything looks pretty good, and that there's nothing more complex going on. So again, this is inflammation of that really thick supporting tissue and the bottom of the foot. Plantar fascia, so plantar fasciitis. Now, Of the people that do have that diagnosis of plantar fasciitis, about 61% or a little more report having pain every single day. And more than almost 54% report that their pain actually interfered with normal work activities, at least moderately. So every day, many people have problems even doing their work activities. And if it interferes with work, then it definitely interferes with their day-to-day activities, their activities of daily living, or their recreational activities as well. Now, a lot of people try opioids and prescription NSAIDs, or non-steroidal anti-inflammatories, like prescription strength ibuprofen. That's about a quarter of people typically will get to that level. Most people end up using some just kind of over-the-counter medications to manage the pain, and that's, again, the NSAIDs and acetaminophen, things like Tylenol. And that's the really bulk of treatment that is initially offered, is medications to try to control the inflammation and dull the pain. Now, in 2018, a report on plantar fasciitis and the use of medications showed that there really is a big lack of evidence from clinical trials supporting the use of anti-inflammatories for plantar fasciitis. So why are we doing that? Well, it's kind of tough to get resolved, and it does seem to give some level of short-term relief, but most people aren't really happy with short-term relief with a chronic problem. You want to get to the root of this chronic problem. You want to get some kind of resolution. So another thing that is often done for plantar fasciitis, besides medications, is a corticosteroid treatment, or a cortisone injection into the bottom of the foot. Now, that has been reported to deliver good short-term relief, but it has been associated with long-term complications, and it can actually lead to serious adverse events, including a rupture of that plantar fascia, where that connective tissue actually kind of disintegrates, kind of rips and tears up. That was reported in a 2008 study. So it's difficult, right? You've got over-the-counter meds, you've got prescription meds, you've got cortisone injections, all of which seem to do some level of short-term benefit as far as pain relief. But if we're talking cortisone, you might end up with a plantar fascia rupture. If you're talking about NSAIDs like ibuprofen, there are just really, really bad side effects to continued use of ibuprofen and other NSAIDs. The estimates are that about 100,000 patients are hospitalized annually for just NSAID-related complications in the gut, and that there's about 16,500 deaths every year from those complications. This is kind of a big issue. And again, this isn't just using ibuprofen for a real brief window of time. We're talking about, with plantar fasciitis, kind of a chronic ongoing condition where use of NSAIDs like ibuprofen is also ongoing. And that really ups the risk of having gastrointestinal problems and ending up even in the hospital for that, or potentially even dying. So that's kind of a big negative, and that's harsh to hear. I know, especially if you're dealing with chronic pain and the medications are the only thing that are giving you any level of relief. But just to recap, that's not unique. All right, if you have plantar fasciitis, that is very common to see some level of short-term pain relief, but no real long-term results from prescription medications, over-the-counter medications, and even cortisone injections, which in themselves can be pretty painful in the short term. Okay, with me so far? That's a lot of information, but just to recap, we're talking about inflammation on the bottom of the foot, real thick connective tissue band, difficult for the body to recover from because of the lack of good blood flow into that tissue. Medications don't seem to work that well. Injections don't seem to work that well. So what are we going to do? Well, you probably know what I'm about to say. Laser therapy has been studied for decades as a way to reduce pain, but also to, of course, improve tissue regeneration, healing, and improving circulation. Like I said, plantar fasciitis, the big problem there is that you don't get good circulation into those tissues. So if we can find a way to get better circulation there, we're likely to have some level of improvement. In a 2006 review, laser therapy was shown to modulate inflammatory processes and reduce inflammatory pain, which is the way those over-the-counter medications work as well, only we don't have the side effects with laser therapy that you do with NSAIDs. And then a 2017 systematic review and meta-analysis showed evidence that laser therapy would be an effective treatment modality to reduce pain in adult patients with musculoskeletal disorders. And plantar fasciitis is a musculoskeletal disorder. So a 2019 systematic review and meta-analysis reported that laser therapy significantly relieves heel pain and that it works with what's called excellent efficacy. And that means that it just works really well. So you can reduce pain. You can see lasting results. Actually, a 2019 study from Wong said that the results of pain reduction were observed to endured for at least 3 months after the conclusion of treatment. And a 2017 study separately from that confirmed that laser therapy was an effective treatment for pain related to chronic, that means more than 6 months worth, of foot and ankle pathologies, including plantar fasciitis, especially in patients with negative x-rays. And that was just 8 sessions of laser therapy in that case. So what I'm saying here is not that we have a cure for plantar fasciitis. Actually, plantar fasciitis can be very difficult to treat even with laser therapy. So what we will often see as being necessary in a clinical setting is that laser therapy is an essential part of getting reduction of pain, reduction of inflammation in that plantar fasciitis case. But it oftentimes needs to be paired with several other things. And there's a few other things that do seem to work without having to go down that pathway of medications or even cortisone injections. One thing that is helpful, seems to be helpful for in many cases, is an overnight brace. And that's kind of a boot that you strap your foot into overnight. You can get these at most drugstores or retailers, or even online. They're not very expensive, but you wear it at night and it helps to hold the foot in a position where that inflammatory junk can't really build up. So it becomes less painful. It helps the body kind of move through this situation. Now, it's not a fix either, but the combination of adding in a brace like that, plus laser therapy and some physical therapy to perform some stretching, that combination seems to work quite well. Again, I'm not saying we have a cure here with just laser therapy, but this is a difficult condition to address. You kind of need to do all these things together in order to see very, very good results. Now, I have seen many cases where we don't do anything but laser therapy and the patient gets better rapidly, and that's fantastic. But especially in these chronic cases that are difficult to treat, I would definitely encourage you to do several things all together, but one of them definitely being laser therapy. It should speed up the recovery and improve your functional capacity, meaning your ability to go and do the things you need to do at work or in your daily life. It should reduce the likelihood of opioid addiction because you don't have to use opioid medications to control the pain. Also, it should reduce the number of treatment sessions overall that you need if you're seeing a physical therapist or a chiropractor or anyone else for this condition, if you're going to have laser therapy added in. Okay, so recap here. Plantar fasciitis. Very, very painful, oftentimes chronic inflammatory condition that affects the really thick supporting tissues underneath the bottom of the foot. Oftentimes, the big complaint here is heel pain, but you can even talk about falls and increased fall risk and disability that can happen with this one. So an important one to get recovered. Difficult to treat because there just aren't a lot of high efficacy treatments out there. Medications can sometimes help short term. Cortisone injections can sometimes help short term, but both of those courses of care have some significant side effects and risks that go along with them. So adding laser therapy can shorten up the course of how long this thing lasts, as well as reducing pain more quickly. We don't have to worry about side effects. And because of the way laser works, by not only reducing pain, but by actually improving blood flow and improving tissue regeneration, you can get the tissues to be healthier and therefore more resilient, meaning they should be less likely to end up with another additional case of plantar fasciitis down the road. So if you're dealing with plantar fasciitis, especially if you're like many patients that our LTI clinics see, and you've already tried multiple different modalities and treatments and medications, and you're still dealing with it, highly encourage you to find a laser therapy clinic near you. You can look on our website, lasertherapyinstitute.org, to find out if you've got a clinic near you. If you're having trouble, send us an email and we'll help you out. info@lasertherapyinstitute.org. Would love to be able to help you find good therapy to get you back on your feet. Have a great week. We'll talk to you soon.
Subscribe to this weekly podcast for more great information. Find a certified laser therapy clinic near you at lasertherapyinstitute.org. If you're a healthcare provider, check out our practitioner-focused Laser Therapy Institute podcast. Thanks for listening.